I just finished signing up for Affordable Care Act Marketplace Insurance for the 2025 plan year. Open enrollment started this month, November. I wanted to share the process so you can see how it works and how much it's going to cost me personally. I have a couple videos about health insurance options for early retirees. I decided to go with Affordable Care Act for the 2025 plan year. We'll see how it goes and I'll keep you updated. I wanted to start by saying I am not an ACA expert by any means. You can talk to a broker to help you. There's even a link for it on the website. It's a good idea and I may end up doing that at some point too. I'm just sharing how I signed up, what plans I was offered, and what I chose. You definitely need to do your own research. The first thing you need to do is go to healthcare.gov. You put in your state and it'll take you to the right place. I live in Washington State, so it took me to the Washington Health Plan Finder website. You click on Let's Get Started and create an account. You make a username, password, put in your email address. You put in your name, your social security number, your gender, if it's just for you or for your household, and your race. Then you put in your address, and there are some additional questions. They want to know if you're a U.S. citizen, an Alaska native, if you're incarcerated, if you use tobacco, if you're a resident of your state, if you're pregnant, for the ladies of course, and what your current insurance is. I put my COBRA information here. I'm using COBRA for the last 4 months of 2024. Then you have to put in your reported household income. This one was tricky for me. I had to guesstimate how much income I would have in 2025. They want your net income from all sources. My small pre-tax pension was easy. It's $800 a month. They had some ways to estimate the net amount. I think it was around $720 a month. YouTube was a wild guess. I overestimated on purpose because I don't want to have to pay back those tax credits. If you underreport your income, they'll see it on your income taxes at the end of the year and you'll have to pay it back. So I estimated $1,000 a month pre-tax for YouTube just so I'm covered. Then they had a bunch of self-employment and business deductions you could put in. So my net guesstimate for YouTube was something like $816 a month. Then I added in interest and dividends from my savings, CDs, mutual funds, and anything like that. It was around $180 a month. Then I had to estimate how much I was going to pull from my retirement accounts. I overestimated about $1,500 a month pre-tax, so it ended up being about $1,350 net. This would have been so much easier if I just had a W-2 job, but then I probably wouldn't need to be looking at ACA anyway. You can see my income section has red around it. I still have to submit proof of household income and deductions documentation by February 4th. I'll do it before then, but I'm not going to start pulling from my retirement accounts until January when I start pulling from my deferred compensation plan. So I'll get it figured out by then. In January, I'll probably contact ACA or a broker to find out exactly what documents they need. I really wanted to overestimate to make sure I was covered. If for some reason you do make more or less during that plan year, it will let you go in and change it. So I created an account and then I could get in and shop for plans. For dental, for some reason, I didn't get any tax credits. Maybe that's just how it works. But I was offered 4 plans ranging from $15 a month to $40 a month. The only one that my dentist takes is Delta Dental, and it was $36 a month. My dentist also offers his own plan where you pay $189 the first month and $43 a month after that. You get 2 cleanings and exams and any x-rays needed. You get one emergency exam per year if needed, and then 20% off any other treatments after that. So I did the math. ACA with Delta Dental would be $438 a year plus a $50 deductible. They pay 50% of fillings or crowns or things like that, and exams and cleanings are no charge. So let's just say worst case scenario, I need a crown. The crown would cost $2,000. I'd pay $1,000 for that crown plus $488 for the premiums and the deductible. That's $1,488 per year. My dentist plan would be $662 for all the premiums, and then $1,600 if I needed a crown. That's $2,262 a year. So between those two, ACA would be less. But if I didn't have any plan, 2 exams and cleanings would be about $460. And the crown would be the full $2,000, so that would be $2,460 a year. If I didn't end up needing a crown or any major dental work, having no insurance at all would be the cheapest. But if I did end up needing a crown or some major dental work, ACA would be the cheapest. There's no way to predict if you're going to need any major dental work, but I decided to go with the ACA Delta Dental. It's only $488 a year for the premiums and the deductible. Then if I break a tooth or need a filling or a crown, I'm covered. For medical, I'm eligible for $695 in federal tax credits to help lower the cost of insurance. I get $87.77 in Cascade Care plan savings if I go with one of those plans. And if I go with a silver plan, I get lower out-of-pocket costs. This is all based on the $3,065 net income I said I would have. And remember, that's reportable income. I've talked before about being poor on paper. Any after-tax money like Roths, CDs, high-yield savings does not count. When you click on Shop for Plans, you can add your doctor, clinics, prescriptions, and things like that to see if the plan you're looking at takes them. They pop up in order from suggested, but you can sort them by least to greatest cost and some other things. The first one that comes up for me is free. It's Ambetter Cascade Select Silver. I haven't read the best reviews for Ambetter, but I also don't know anyone personally that's used them. This plan does not have my doctor listed, but I'm not personally that attached to my doctor, so that's not going to be a deciding factor for me. I can also still go see my doctor, it'll just cost a little more. I went separately to Ambetter's website to look up what doctors they do use in my area. Then I looked up reviews for those doctors. I think I can make this work for a year. I don't have any serious health issues, so that was option 1 for me. Then choice 2 was Ambetter with a bronze plan, and that came up as $1.05 a month. This one came up as choice 3. It's $1.82 a month. This one is $69.33 a month. This one is $74.81 a month. These also do not have my doctor listed. Molina Cascade Bronze is actually the first plan that had my doctor listed. It was $83 a month, so if I wanted to keep my doctor, that's how much it would cost. The most expensive plan I was offered was $980 a month. No thank you. I had 35 health plans to choose from. There are so many things to look at and consider. There's your premiums, your primary care visit cost, generic drug cost, out-of-pocket max. Is a primary care provider required? The annual deductible, the plan type, exclusive provider organization or an EPO, or health maintenance organization or HMO were the 2 kinds that were offered to me. You can also compare plans. Here I compared the free one with the least expensive one that would take my doctor. The more expensive one had a much higher deductible. They're both HMOs, and like I said, I'm not particularly attached to my doctor, so the free one looked best to me. You can also click on more information for each plan. Here's the information on that free one. This one's an HMO and I will need a primary care provider. It has a $2,500 deductible. So unless I end up with an emergency or surgery or something, I probably won't get too much coverage. But that's okay with me. I get an occasional sinus infection or things like that, but I hardly ever go to the doctor. I'll end up paying for most of those things out of pocket, but if I end up having something big like an emergency, I'm covered. It also looks like the first 2 visits are only $1 copay. I spent a lot of time researching my options. At this time, I'm healthy and I don't take any medications. But I don't want to go without insurance. I briefly considered going a few months without insurance. But then I ended up with some health scares. During the colonoscopy I had in September, they did find polyps and removed them. That bill before insurance ended up being $8,000. And that was for a same-day procedure. So the $700 a month I would have saved if I wasn't using Cobra insurance would not have covered that. I only ended up paying a couple $100 for this bill. One thing I learned is that Washington State is number 3 in the top 5 states for the most affordable health care. That, combined with my low taxable net income, makes it so I can get free medical insurance in 2025. I'll see what's going on at the end of 2025 and reevaluate then. Ultimately, I decided to go with the free one for now while I'm still healthy. I'll have to elect limited coverage for my HRA and will only be able to use it for dental and vision. I'm going to try it for 1 year and see how it goes. I'm covered in case of a catastrophe, like if I break a bone, get appendicitis, cancer, or anything like that. Be aware that the future of ACA subsidies is uncertain after the year 2025. It depends on potential future actions by Congress. The premium tax credit enhancements began in 2021 and are set to end at the end of the 2025 plan year. If the enhancements are not extended, some people may make too much money to qualify for tax credits. My personal backup plan for this is going with a health share plan in 2026 if an ACA plan is going to cost me more than $300. A health share plan would run around $300 a month for me for 5.5 years until I can get Medicare. With this option, I could use my HRA money to pay for all out-of-pocket medical costs. That's all costs except the health share premiums. My sister, who retired early, has been using a health share plan for years. She's been very happy with it. She uses Christian Health Ministries. Dave Ramsey recommends them. I know a friend of a friend who also uses Christian Health Ministries. She had a heart attack and ended up in the hospital for several days. They covered all of her bills except for that initial unshareable amount, which is kind of like a deductible for each incident. I've read a few reviews of health shares where bills didn't get paid, but I've also read many reviews of health insurance companies that refuse to cover a bill too. I think that can be an issue no matter what route you go. I hope this helps give you an idea of how the process goes. I'm sure it's a little different in each state. If you have any experience with ACA plans, please let us know in the comments. I'd love to read about your experiences. If any of you are seeing me for the first time, hi, I'm Julie and this channel is Happy on Monday. Thanks for joining me. If you found this helpful, please like. And if you're interested in early retirement, consider subscribing. I'm going to leave you with a quote. We don't grow when things are easy. We grow when we face challenges. Hope to see you again soon.